Surgery is a branch of medicine that requires not only knowledge of the anatomy, but also skill in the use of implements and tools that extract parts of or repair the human body when necessary. Today, we warmly welcome Dr. Osborne to Good Morning SKN to learn about what it takes to be a surgeon. Good morning, Dr. Osborne. Welcome.
Good morning, everyone. Thanks for having me here.
You are certainly welcome. So we're going to dive right into it. Is there anything in particular that motivated you to become a surgeon?
Well, my desire to become a surgeon started when I was just a little tot. I often ask young individuals what are their dreams, what are their aspirations, and sometimes amazed when someone at 14 or 15 are unable to say what their interests are. But since I was a child, I could remember always wanting to be a doctor. That was a dream that I had. And growing up impoverished and in a low-income household family, I never thought that that dream was possible. And my passion for surgery, it has always been there. So not only did I want to be a doctor, I also knew that I wanted to be a surgeon. It may be funny for me to say, I could have been seen as a young child playing with the fowls in the yard, the different animals, trying to be the healer. If we had a dog that was sick, I would bandage the leg if there was a cut. So you could see me doing that. And I was very curious about the anatomy. I would be seen even playing with little creatures, little crawling insects, the lizard, trying to explore their bodies and saying that I am operating so that I can see what was going on.
So did you actually perform a surgery at that point in time?
I would keep that to myself. So my brothers would be the ones who go and bring the little creatures or insects, and I would be the surgeon exploring and seeing what I can do and how I could fix.
Yeah.
So that's where my passion comes from. I think that was something that was always in me from very early. My only struggle was knowing how I was going to get to that point.
Oh, nice. Commendable. It's good when we find out early. So what's your favorite aspect of surgery then? Because definitely you can't be afraid of blood, because we have some persons interested in being a doctor, and that's the thing that hinders them.
Well, my favorite part of surgery is just a general love for medicine, and the passion for surgery comes where I'm a dynamic person. I'm always going. I'm always very interested in seeing results. I'm the person who loves to see a patient comes to the emergency room, is taken to the operating theater, and then you have a results, usually positive. That's what we're hoping, within a day or two. And that's the beauty of surgery, because your outcome generally can be the matter of life and death. It can be determined by minutes or seconds, the decision that you make. So I like the sense of the adrenaline in it, the activity that comes from surgery, the dynamism of surgery. So I love that. So it keeps you interested, it keeps you on your toes. And once you see you have a good outcome with your patient, that's one of the most beautiful things that you can have as a doctor.
Oh, maybe give us a few tips, because we've seen on TV where doctors and surgeons might use a doll to show a child, well, like prep for surgery. Is there always prep for your surgeries?
In terms of
preparing the patient.
Preparing the patient,
mentally,
of course. So it all depends. If we have our major surgeries are usually elective or emergencies or urgencies. It depends. If it is an elective surgery, you have much more time to sit with the patient, explore and explain what is exactly going to happen. But if you have an emergency, a gunshot wound, a stab wound, you're limited by time, and your objective, you want to get the patient to the emergent operating room as quickly as possible to have the best outcome as possible. So it depends on the timeline and the type of surgery that you have. But we usually have a period where you explain to the patient, give them an idea what's the diagnosis, and what is the likely outcome, what are you hoping to do. So that is...
Okay.
So what is your most frequently performed surgical procedure?
Oh, very interesting question. Internationally, one of the most frequently performed surgical emergency is an appendectomy. And when it comes to elective cases where patients, the case is planned, usually it's hernias. For general surgery, it can be a hernia at the umbilicus, it can be a hernia in the inguinal region, it could be what we call an incisional hernia, where a person would have had a previous surgical operation and you have a hernia as a result of a post-op complication. So you can have that.
Interesting. So do patients normally get referred to you then? Because I personally experienced both the appendicitis and also hernia, and the experience was good. But those are, as you said, one is emergency, one is elective. So is it a matter of referral? Because my first one was referred from another doctor. So how does a surgeon deal with referrals, and is it different in both cases? Is it different in terms of emergent or elective, or both are the same?
Usually, if we have an urgent or emergent case, the patient is seen at the hospital. If you're at home and you're feeling ill, you're having tummy aches, you're having abdominal pain, vomits and nausea, you usually would go to the hospital, to our emergency room. And the physician in the emergency room would then evaluate the patient, and if it's necessary, would call the surgeon to come in and see the patient. And if there's a surgical diagnosis, and the patient is then taken to the operating room. On the other hand, if the patient is an elective case, so let's say, for example, you are diagnosed with an umbilical hernia, and you see your family physician or a personal physician, and in the examination that is diagnosed, then you can then be referred to a surgeon. And there are various surgeons. Sometimes the doctor may refer to someone who they have a relationship with, or they would ask you, who do you prefer? Because you may have a preference as well too. So that is usually how the referrals are done.
But I must commend you, Dr. Osborne, because at my time we didn't have many choices. We didn't have much choice. It was just one, and yeah, fortunately I'm still here.
Yes.
So in terms of surgery, at what point would one, I guess, in medical school, let's take a little trip back to medical school. When did you start doing courses towards surgery? Because were there any general requirements that all doctors have to go through first before they can specialize? Because you went to school knowing you wanted to be a surgeon.
Yes.
Right.
But just as most things, as a doctor, you're trained to be a general doctor at first. And during our tenure in medical school, you have different rotations where you spend a block of time in different areas of specialty. There was OBGYN or gynecology, we had the pediatric service, we had the internal medicine service, we have the general surgery, we have ophthalmology where you deal with the eyes, and you're rotating to these different bodies of service. And then as you go and you explore in each service, you would then be able to decide what do you have the affinity for, what energy you like, what suits you best. And from there, usually persons are able to narrow down the field. But I came in already with the notion that I want to be a surgeon. I like that energy. I like the fact that you can see the outcome. I like the fact that you can be practical. And I think I could take it back to my family roots, because my dad works a lot with his hands. And surgery, if I can say, to make it, it's like you're being a tailor or you're being a carpenter, because you're working with your hands a lot. And I think that is where my strength lies. So that's where I developed the passion for general surgery. In the history of medicine and surgery, the general surgeon was a person who covered from head to toe. With the advent of time and the advance of time, the areas started to become subspecialized. The neurosurgeon is the one who focuses on the brain. So that is what Dr. Ben Carson was. And I remember as a child, I read his book, Healing Hand. I was so impressed. I was so invigorated about pursuing this career in medicine.
And he's a black man.
Yes, yes. And he's also of our race. So that made me so proud of reading his story and hearing how he came up in an impoverished situation as well too. So those are persons who would have inspired me along the way. So apart from neurosurgeon, you have the cardiac surgeon. You have the person who deals with the heart if there needs any surgery. You have right now a cardiothoracic surgeon that focus on the thorax, or what we call the chest area. So those are hyper-specialized areas in first world countries usually. But we have a small community here. And oftentimes it's not feasible to have all of these subspecialties. So hence the general surgeon originally was able to cover most of these. So for example, There are times when, as a general surgeon, we may have to do, a patient has a bleed on the brain urgently, we may have to do a procedure to relieve that in order to save their lives. We may have to go into the chest if there was a stab wound or gunshot wound. So it covers a wide area, but then the subspecialties came out. Okay, even as a gynecologist, you're focused just as that person focuses on the female reproductive system and organs. So yes, that is how the advent of the subspecialties came about. As a general surgeon, I could then even go on further and subspecialize in another area of surgery. So that is how it usually is.
Would you like to?
I would love to, but my passion is still general surgery and working in that area.
See, I was going to ask something like that because you said the fact that you had the opportunity to go into different specializing area and you just stuck to what you wanted to do. If there was another thing that you could do, what would you pick?
I knew I wanted to be a surgeon, so I was going to choose any specialty that would allow me to operate. Okay. I like the idea of being in the operating room, to see the human body, to look and explore the anatomy of the human body. I also thought that if I did not become a general surgeon, maybe I could become a urologist. That's this area that you focus on the male reproductive system, the urinary system. Kidney. Yes, okay. So that might have been an option, but it was way below general surgery. I was a child who knew exactly what she wanted from very early.
And you stuck it out.
And I stuck it out.
No,
commendable.
No, say I would like to, or not would like to. Maybe, well, it could be an elective surgery. Say I would like to undertake an elective surgery. What are some of the common misconceptions that people may have? For example, I may be apprehensive about doing this surgery.
Okay, one of the first things I would like to say about this, oftentimes persons would say, oh, surgeons just like to cut. But that's the whole premise of being a surgeon. You have the internist who would see the patient, deal with you if you have hypertension, diabetes, heart disease, but you have the surgeon now. If there is a surgical issue, then they wouldn't need that. So as you ask this question, usually if a patient has a diagnosis that may require surgical intervention, your first objective would be to see the surgeon, sit down with them, they'll discuss. You will then have your lab works done. You will do all your testing preoperatively just to ensure that you are well and sound to undergo this surgical procedure. So it's not just taking you to the operating theater. There's a lot of pre-operative work that goes on. Sometimes you have to see the cardiologist before. You may have to see different areas of specialty just to make sure that you're fit enough and well enough to go undergo this surgical procedure. And it's not just a surgeon, it's a vast team that is working together to make sure that the patient have an excellent outcome. So we sit with the patient. What I enjoy doing is talking to the patient with the discussion of what is going to happen. I love to draw as well, so that's a little hobby of mine. So I would take out my paper, I would make a quick drawing of this is the human body, this is what you're expected to see, talk about the pros and cons and the complications. So it is very important to explain to the patient what are the likely outcomes, what are the likely risks, so make sure that patients are usually then feeling much more comfortable once they have the necessary information.
In your training, maybe at university, have you ever had to do one of those surgeries, for example, where they've had like Siamese twins, where there's connections between two different completely anatomies, stuff like that? Tell us an exciting thing you did maybe in school.
Oh, exciting things. No, well, to your specific question, no, I've never had to do that because
you mentioned teams of doctors.
Yeah,
and
that's that it would be extensive. I've never had to do that. Lots of those are much more super specialized areas, super specialized centers. But some of the most exciting things I've had to do was dealing with a patient. We had a patient who had a cancer of the esophagus. That's where you had to, that's a tube that allows the food to go down into your stomach. And we had to resect or remove that esophagus and then reattach it with the stomach, and those procedures are beautiful to see. You don't want to have to see them. Nobody wish that anyone gets ill, but if you have to participate, and it's such a fine detail, there's a lot of preparation that goes into those type of surgery, and lots of hours standing there in the operating room. So you have to love what you do, because you stand for hours, but once you're enjoying it, the time goes like that.
I can see the excitement on your face, so I can tell you are definitely
I am thinking also like a challenge.
Yeah, because I'm listening to remove, reattach, and you're smiling during the whole thing.
Yes,
Wow.
it takes a special skill for that, definitely.
No, it definitely does. Definitely does. So, Dr. Osborne, in your opinion, what is the most important part of your job as a general surgeon?
I would say to make the patient feel at ease. Okay. That is very important. Once you've gotten the trust of the patient, you can usually do anything else. Because if you're working with a patient who has a little faith in you or is extremely nervous, it's hard to work with that patient. Why? Because then every decision you may want to make from a medical point of view, you have to second guess, or the patient is second guess you. So I think you have to have that that understanding with your patient, and make sure that they understand that you're there for them, and your only responsibility is for them to have their best outcome, and you're there as their teammate to work and help them through this difficult time. So once you've got the trust of your patient, I think you're more than halfway along there.